Thank you for choosing Doylestown Hospital's Orthopedic Institute for your upcoming surgery. We are extremely appreciative of the fact that you have elected to have your joint replaced here at Doylestown Hospital. This presentation is for total knee patients that are staying overnight at Doylestown Hospital. Please refer to your teaching packet throughout this presentation. We are committed to helping you through this journey. No question is too small, and although we have tried to capture the most common questions, we know you may still have some. If you have a question, please call the Orthopedic Navigator at 267-893-9303. If you have not read the Total Joint booklet, please pause the video and read the book first. Here at Doylestown Hospital, we are proud of our orthopedic team. We have received Joint Commission Specialty Certification since November of 2010. We were a charter member for the American Joint Replacement Registry, and we consistently score high patient satisfaction scores. The goal of this presentation is to alleviate anxiety, understand the pre-operative, surgical, and post-operative processes that you will be going through, and to prepare you for your knee surgery. We want to identify and clarify things you need to do before your surgery, and we also want to identify the equipment that you will need to purchase prior to surgery. You were provided with a pre-admission folder by your surgeon's office. Please bring this folder to all appointments with you. The important information regarding your surgery is in this folder. There's directions to preoperative testing areas. There's the questionnaire that you will need to complete along with your medication list for your pre-admission visit. And there's also a slip of paper that tells you the date for your pre-admission physician assistant visit. This appointment usually is 1 week prior to your surgery. In your folder, you will also have important information about the hospital. You will also have the Orthopedic Navigator business card in the lower right-hand corner. You will be receiving a phone call from the Orthopedic Navigator. She will identify her role. She will discuss your tentative discharge plans and our goals of our program. She will answer any questions you may have. Again, you can find her business card in your folder. The hospital will call you to schedule for your pre-admission testing. This is usually scheduled 3 to 4 weeks prior to your surgery. Please complete the pre-admission health questionnaire and medication list found in your folder. We also ask that you bring your medicine bottles with you to confirm the list. You will have some testing. This will include blood work, and it would also include EKG if not going to see the cardiologist. If there are any issues with any of your testing, the physician's assistant will contact you directly for follow-up that may be needed. During your pre-op nursing visit, you will meet with a nurse who will review your completed questionnaire. She will review your medications, and she will review with you any pre-op instructions that are important to follow prior to your surgery. In your folder, you will see your pre-admission checklist. This was developed to help you plan for your upcoming surgery. The pre-admission nurses in this presentation will go over all the items on the list. If you need clarification, let the Orthopedic Navigator know, and she will be happy to help you. Please take time to fill out the entire questionnaire before arriving for your testing. Once your pre-admission testing date is scheduled, you can go ahead and make your appointments for your clearances from your family doctor, your dentist, and if needed, your cardiologist. You may need to have an anesthesia consult based upon your surgeon's recommendation. All of these clearances must be completed prior to the pre-admission physician assistant visit. but they should be scheduled after your pre-admission testing date. That way, they can use the information in the test to better make their decision about whether or not you are able to be cleared for surgery. As stated previously, you will meet with the physician's assistant. She will review all the pre-admission testing information, and she will make sure that you are able to be cleared for your surgery. If there are any issues, she will give you a call. She will review with you your medical history, and she will perform a physical. She will also review your medication list. She will also review your post-operative plan of care, and she will also be involved with your post-operative medical management following your surgery. In the month prior to surgery, you want to make arrangements for someone to be with you a few days after you go home. We would like you to purchase the necessary equipment or supplies that are needed. We would also like you to pick up all the throw rugs in your house and make sure your house is free from tripping hazards. You will be using a wheeled walker, and throw rugs are tripping hazards. We also want you to pack your clothes and toiletries for the hospital. If the plan is for you to go to outpatient physical therapy, we would like you to make arrangements for someone to be able to drive you to the therapy appointments. The navigator will discuss dates with you that therapy should begin. If your insurance requires a referral for outpatient physical therapy, we ask that you call your primary care doctor to receive this referral. Also, if you are told to stop certain medications prior to your surgery, we ask that you follow the instructions provided. In your packet, you will see a yellow form. This is the medical equipment form. This is all the equipment that you may need. On the back side of the form are local equipment companies where you can purchase any needed items. You can also purchase these items from any drugstore, or you can even purchase them online or borrow them from a friend or family member. You should make sure that you have all these items prior to your surgery. You will need a wheeled walker after surgery. It should be a 2-wheeled walker, not a 4-wheeled walker. In order for it to be covered by insurance, you must have a doctor's prescription. All insurances are different and cover different amounts. If you have not purchased or borrowed a wheeled walker prior to your surgery, please let us know during your hospital stay. The physical therapist at the hospital will issue you a walker from an outside vendor. The outside vendor will bill you for anything your insurance does not cover. Paperwork will be given to you at the time of issuing a walker for your records. If you have any issues with the walker, upon discharge, you will need to contact the vendor. You will also need a single-point cane. It will be used to go up and down the steps, and it will also be used when you progress from the wheeled walker to a cane. The best type of cane is an adjustable cane. Most insurances will only pay for one assistive device, so it is best to have your insurance pay for the walker, not the cane. Depending on your height and depending on the height of your toilet, you may need to purchase either a 3-in-1 commode, which is shown on the left, or a raised toilet seat with rails, which is shown on the right. Most insurances do not cover these items. Depending on your shower tub setup, you may benefit from having a tub seat with or without a back, grab bars, or a handheld shower head. Most insurances do not cover these items. Please look at your bathroom prior to your surgery and make sure that you have the necessary equipment needed to be safe in the bathroom. If you are in need of grab bars, temporary suction cup grab bars are available. You can get these in stores or online. However, you should make sure they work prior to your surgery. They do not stick on all surfaces. The week prior to surgery, we are going to ask you to do more things. 3 days prior to surgery, we are going to ask that you begin to shower with your special soap. You can see the handout in your folder. We also ask that you use clean sheets, clean towels, and that you wear clean pajamas. We ask that your pets do not lay in bed with you. Also, the 3 days prior to the surgery, we ask that you use the mupirocin ointment in your nose in the morning and evening, 3 days prior to the surgery, and also in the morning before you come to the hospital. So that means that you will put the ointment in your nose in the morning, in the evening, and in the morning of surgery. If for some reason you were not given a prescription for the ointment, please call your surgeon's office and they will call it in for you. You usually receive the mupirocin prescription at the time of your physician assistant appointment. You do not need to bring this medicine to the hospital. The day before surgery, we ask that you call the surgeon's office between 3 and 4:30 p.m. to find out the time you need to arrive at the hospital. If surgery is on Monday, call on Friday. Do not eat anything after midnight. You can drink clear liquids up to 2 hours prior to your surgery arrival time. You may be asking, what is a clear liquid? It is any liquid you can see through. Water, apple juice. You can also have black coffee and tea, but no cream. You cannot have alcohol. By not adhering to these guidelines, you may have to cancel your surgery. Again, you can drink clear liquids up to 2 hours prior to your arrival here at the hospital. On the day of surgery, do not eat anything after midnight. Only clear liquids up to 2 hours prior to your arrival. We want you to shower using your special soap in the morning. We want you to use your nose medicine at home prior to coming to the hospital. When you arrive at the hospital, please report to the same day surgery area on the 2nd floor of the main building. It will be the same area where pre-admission testing is. Please check in at the volunteer desk. Only one person is allowed to come back with you to the pre-op area. Additional guests can remain in the atrium waiting area. You will be escorted to the same day surgery area by a volunteer. Once you go back into the same day area, the nursing staff will begin to prep you for your surgery. Your IV will be started. You will receive fluids, pain medications, and antibiotics. You will have the IV in during the whole hospital stay. It will be capped if not being used. Your leg will be cleansed with wipes. Hair will be clipped around your knee if necessary. You will be fitted for TED compression stockings. These stockings should be brought home with you upon discharge. Your leg will be initialed to ensure surgery is performed on the correct knee, and you will use the restroom prior to going to surgery. You will meet with the anesthesiologist. Nursing will review all your medications again. If you are on any new medicines or vitamins, please bring those. Also, if you were told to bring any medications the morning of surgery, please make sure that you do bring those. Based on your past medical history, you may be instructed to meet with an anesthesiologist prior to the day of surgery. This option is also available to any patient at your request. If you have specific questions, let the orthopedic navigator know, and she will assist in setting up an individual meeting for you. Please visit the following website to review anesthesia options. When it is time for your surgery, you will leave the same day surgery area and go to the holding area of the operating room. If you are the first surgery, you will go right back to the OR. Prior to the OR, you will be given a dose of antibiotics. You will also receive 2 additional doses following your surgery. During the OR, your vital signs will be monitored, including blood pressure, heart rate, and oxygen levels. Unfortunately, no family members are permitted in this area. Your actual surgery will take approximately 1 hour. Your physician works with the vendor prior to your scheduled surgery to ensure that your new knee will be the correct size. The hospital team prepares the new joint prior to the surgery so it is ready for you. An incision is made in the front of your knee. The length will vary based on your body type. The length will also be as long as needed to access the joint. You may be thinking what happens in surgery. Basically, what happens is the damaged or degenerative parts are removed and replaced with new artificial parts. In order to understand what is replaced, we will review what a normal knee looks like. As you can see from the picture on the left, this is what a normal knee looks like. The picture on the right shows what we are replacing. There is a femoral component, there is a tibial component, and there is also the back of the patella that is replaced. Your new knee will have a cobalt chrome cap on the end of your femur, or the thigh bone, a titanium plate on the tibia, or the shin bone, a polyethylene spacer in between the tibia and the femur, and a button may be placed on the undersurface of the patella, or the kneecap. Bone cement will be used to keep the artificial parts in place. Our surgeons do not cut the quad tendon. The parts are tested by moving your knee in multiple directions to ensure a proper fit. X-rays are taken to ensure that it is in proper position and in alignment with your other leg. Your incision is stitched with dissolvable stitches on the inside. Depending on the surgeon, your incision will be closed with either staples or glue. You will be given instructions for when to have your staples removed. A special protective covering will be placed over your incision. You will be told when to take this covering off. You can shower with this covering. You will also have foot pumps placed on your feet in the operating room. These will stay on your bed and be on while you are in bed. You are transferred from the OR table to your hospital bed and then taken to the post-anesthesia care unit, which is our PACU, to recover. While in the PACU, your pain will be assessed and medications provided through your IV. You will receive an adductor canal block, which will help with your pain. They will make sure that you are comfortable and that you safely come out of anesthesia. Your time in the PACU will depend on how you are recovering and if your room is ready for you. Family members are not permitted in this area. Depending on your past medical history, you may have other physicians come to see you while in the hospital. This may include a hospitalist or a cardiologist. Once you are ready to leave the PACU, you will go to the floor. Again, you will be in the same bed that you will have during your stay. You will be greeted on the 4th floor by a nurse who will do an assessment. The nursing staff will take your vitals frequently and will monitor your pain levels. They will give you pain medications as well as 2 doses of IV antibiotics during your stay. Because you had surgery, you will not be permitted to get up by yourself. You must ring your call bell for help. Physical therapy will begin on the day of surgery. You will have foot pumps on your feet while in bed in order to prevent blood clots. Remember, these are attached to the bed. We do not want you to get up. Please ring. Ice packs are available to help with your knee pain and can be changed throughout the day. You will begin to take pain medications by mouth once you begin to eat. All meals are ordered through our At Your Request program. They are made to order and are delivered within an hour of ordering. Staff will assist you with ordering your meals if needed. As stated in the anesthesia video, multimodal pain management is used. The plan starts prior to the surgery and continues during your stay. You will be giving medications based on your level of pain. You will need to ask for your pain medications. Your medications will be explained to you by the nursing staff. We use a pain scale of 0 to 10 to rate your pain. See the purple sheet in your folder. You will be asked your pain level several times during the day. Pain medications work different ways and people respond differently to medications. If your pain is not tolerable, you need to let us know. You are having an orthopedic surgical procedure and you will experience pain post-operatively. Our goal is for your pain to be managed appropriately to allow you to be as comfortable as possible and able to participate in therapy. Pain medications do cause constipation. You'll be prescribed a stool softener while in the hospital. You should continue with this medication at home. If you go longer than 3 days without having a bowel movement, you need to let your surgeon know. Upon discharge, you will be given prescriptions for pain medications to use when you go home. ShopRite Pharmacy is located on the first floor of the hospital, and you can fill your prescriptions there, or someone can take them to your pharmacy of choice to be filled. When you go home, it is important for you to take your medication as prescribed. If you have any questions, call the surgeon's office. If you have any issues or your pain is not controlled, you should call the surgeon's office. Even though the orthopedic physician's assistant's name is on the bottle, we ask that you call the surgeon's office as they are available 24 hours a day. The salmon-colored sheets in your packet reviews the common medications that are given on the orthopedic unit. This form will be completed for you when you are here. The salmon-colored sheet lists several side effects for pain medications. If you are experiencing any of these, you need to let your surgeon know. To help prevent blood clots following your surgery, most patients will be instructed to take 325 milligrams of aspirin once per day for 4 weeks. If you are already on Coumadin, your blood work will be monitored post-operatively. Unless notified otherwise, your surgeon will be responsible for monitoring your Coumadin levels when you go home. If you are on a special medication, such as Pradaxa or Eliquis, you will be placed on Coumadin post-operatively and then will return to your pre-operative medicine when instructed to do so. You will be provided with specific instructions at discharge. You will be given instructions upon discharge for when your special dressing is to be removed and if you have staples when they will be removed. You should use good hygiene at all times in order to prevent complications. You should call your surgeon if your wound is draining, you have a fever, or there is redness in your leg or around your wound. Discharge planning, as I said before, starts prior to surgery. The goal is for our patients to go home directly from the hospital. Over 95% of our patients go directly home. Research shows that the best way to recover is in your own home. However, this is not always possible, and each patient is assessed to ensure that home is really the safest option. At times, the plan that you had in place may change depending on how you are doing. The orthopedic navigator will assist you with discharge planning and any needs you may have when you leave the hospital. If you are unable to go directly home, the navigator will discuss your options with you. Everyone has different insurance plans, which can impact where you're able to go. When you're ready to be discharged, it may be recommended that you go home with home care or that you go home and receive outpatient therapy. Unless your insurance dictates that you use a specific provider, you have the ability to choose where you would like to go for therapy or who your home care provider is. The navigator will discuss the options you have available to you. We do recommend that you use our Doylestown Hospital home health services and our outpatient therapy. Our staff have extensive training on your surgeon's protocols. They work closely with the surgeons to ensure that you are on the path to a speedy recovery. A few days after discharge, you will receive an email from the address below, Doylestown Hospital Orthopedic Institute at ortechsystems.com. Please complete the survey that is attached to that email. We value your input and use responses to maintain and improve our services. If you have any issues during your stay here, please let someone know immediately. You will also be sent emails to complete a questionnaire about how you are functioning prior to your surgery and at periodic times during your recovery. Please complete them as they are used to track and monitor your progress. This email will come from Doylestown Hospital Orthopedic Institute at ortexsystems.com. I am going to go over a few frequently asked questions that people have. It may be up to 4 hours from the time you arrive at the hospital to the time you get to your room on the orthopedic floor. Your family is welcome to wait in the family waiting area on the second floor, and they will be provided with updates about how you are doing. Your surgeon does come out to talk to your family afterwards. You should bring comfortable, loose-fitting clothes to the hospital, along with supportive shoes with non-slip soles. Shoes without ties are always easier. An updated list of all your prescriptions and over-the-counter medications need to be brought to the hospital for the morning of surgery. If you are going to use a cell phone, we ask that you bring your charger. Any personal items such as cosmetics or toiletries should be brought to the hospital. Please do not bring any valuables. On behalf of everyone here at Doylestown Hospital, I would like to thank you for picking us to have your knee replaced. Whether you're having a single knee replacement or a bilateral knee replacement, we are looking forward to you coming to the hospital for your new knee. I also would like to thank you for watching this presentation. Please click the button at the bottom of this page to verify that you received this education, and we will see you soon. If you have any questions, call the navigator. She'll be happy to help you. Thank you.